Penis size is one of the most discussed, misunderstood, and anxiety inducing topics in men's health. People ask, what is considered normal? How do you measure it correctly? And can size really be changed? Today, let's cut through myths and focus on what medical science actually says. Surveys show that around 96% of men who worry about their size are completely within the normal medical range. Most concerns aren't about the body itself, but about body image. Men compare themselves to unrealistic standards, often from adult films or edited content where size is exaggerated. In reality, women do not place nearly as much importance on size as men think. More than half of men report anxiety about it, while only 5 to 10% of women say it plays a significant role in attraction. I'm Dr. Zara, a urologist and sexual health expert, and my goal is to help men reclaim their strength, confidence, and vitality using science-backed natural methods that truly work. So, let's talk measurement. Accuracy matters. Length should always be measured from the pubic bone, not from the skin. Place a ruler or tape measure against the pubic bone, press gently through the fat pad, and measure to the tip of the glans. This method can be used in both flaccid stretched and erect states. In fact, flaccid stretched length is considered the best scientific predictor of erect length. Girth, or circumference, is measured around the mid-shaft of the penis, not at the base or the tip. Use a soft tape measure or a piece of string wrapped around, then check where it meets. This can be done flaccid or erect, but studies focus mainly on erect girth. Many men misjudge themselves because of poor technique or by comparing a flaccid measurement to someone else's erect one. Now, what do the numbers show? A global meta-analysis covering nearly 15,000 men provides clear benchmarks. The average erect length is about 12.2 centimeters, just over 5 inches. 90% of men fall between 10 and 15 centimeters. That's roughly 4 to 6.5 inches. At the extremes, a micropenis is defined as under 6.5 centimeters erect, while very rare cases above 23 centimeters, over 9.5 inches, are called macropenis. For girth, the average flaccid circumference is about 9.3 centimeters or 3.4 inches, and the average erect girth is about 10.5 centimeters or 4.7 inches. Again, most men fall comfortably within these ranges. So the takeaway, if you are within these ranges, you are medically normal. Even if you're outside, it doesn't define your health, your masculinity, or your ability to be a good partner. Anxiety often comes from comparing yourself to distorted media images, not from reality. But what about enhancement? Procedures do exist, but none are risk-free. For girth, the most common method is injecting hyaluronic acid, the same filler used in cosmetic facial procedures. This can increase circumference by 2 to 3 centimeters, but usually lasts only a year or so. It's safer than permanent fillers, but not without risk. Non-absorbable fillers like silicone or PMMA can cause chronic complications such as lumps, inflammation, and even permanent damage, and they are not recommended by medical authorities. For length, options are limited. Liposuction of the pubic fat pad can make more of the shaft visible, but doesn't actually change length. Cutting the suspensory ligament may add 1 or 2 centimeters in a flaccid state, but does not increase erect length, and it can cause instability. Penile implants are designed for erectile dysfunction, not cosmetic enlargement. In short, there is no safe, permanent, medically approved method to significantly increase penis length. History also shows how cultural ideals change. In ancient Greece, smaller genitals were considered signs of intelligence, discipline, and refinement. Larger sizes were often depicted in art as grotesque, comic, or associated with uncontrolled impulses. This proves that what society considers ideal is not fixed, but shaped by culture, which brings us back to today. Penis size anxiety is less about biology and more about perception. Scientific research proves that most men fall well within normal ranges, and the real focus should be on overall health, self-confidence, and how you connect in relationships. The truth is simple. Penis size does not define your value, your masculinity, or your ability to please a partner. Accurate measurement and medical knowledge can replace myths with facts and hopefully ease unnecessary worry. If you found this video helpful, don't forget to like, share, and subscribe to the channel for more science-based insights on men's health and confidence. Your awareness and understanding are the first steps toward real strength.